Hi, welcome back to my channel. You have decided that you want to be a urologist, and now what? I'm here to share 5 things that I think will make you a competitive candidate during the residency application process. Stay tuned to find out what those are. Just a brief introduction. My name is Albert and I recently graduated from our Urology Residency program this past June and started a fellowship. I had the opportunity to participate in interviewing applicants and some of the deliberation process during residency. I'm here to share with you some of the advice and tips I have for someone who want to be a urologist. Now, before we start, I do want to put out a disclaimer. These are based on my personal experience and might not be applicable to everyone, and not all program out there might be looking for what I'm about to discuss. Applying to urology is competitive. When I was applying, there were less than 300 first-year spots available in the whole country, with a match rate in the mid-70s. Recently, there has been an increase in spot. At the time of this recording, there are about 350 first-year spots with a match rate in the low 80s%. I will be going over 5 things I think most programs are looking for in an applicant. The first thing I want to talk about is research. So now, why are programs interested in people who do or have research experience? For 3 main reasons. First, it shows motivation. For anybody who has done research in the past can tell you, research takes a lot of personal drives. Research can be tedious, especially databasing, and also could be really confusing trying to know the different statistical analysis. Secondly, I think it's a way for a program to get their name out there. As you can imagine, residents present their research at various conferences or publish their research can really boost the program's reputation. And thirdly, I think the most importantly, a lot of us get into this field to help others. I think research is a way for us to advance our field and so we can better care for our patients. Now, personally, my medical school really doesn't have much urology research, so I just cold email almost all the programs around my school, and I was fortunate to be able to find a urology related research. I was able to do a month of elective research rotation there and work about 3 months remotely. And if I remember correctly, at the time when I applied, I have 2 abstracts that was accepted to conferences and 1 manuscript in the work when I was applying. Even if your research is not ready, please list them on your CV. It does show initiative. Now, what if you just can't find any urology related research? Honestly, even if it's not urology related, when prior to me knowing what I feel I want to go into, I did research in standardized testing and neurology. And believe it or not, my work on standardized testing actually came out more during my interview than my urology related research. The second thing I want to talk about is letter recommendation. Urology truly is a small community. As I previously mentioned, there are just shy of 300 residents a year when I applied. If you really think about it, that's only about 3,000 urologists trained in the last 10 years. And I'm not being dramatic. Everyone knows everyone or knows someone who knows someone. If you can get a letter from a well-known urologist, aka a bigwig, to write you a good letter recommendation, it can be the thing that makes or break you, especially when the program is considered between you and another applicant who are very similar on paper. Now, let me tell you a little story. During one of my sub-Is, one of the residents told me he only had 5 interviews during the mid-interview season, and he was stressed. But he got one of the big wigs to write him a letter, and he got almost 20 more interviews after that. This obviously worked out for him as he was a urology resident. That being said, it's important that you truly interact with the faculty and urologists and feel that they can write you a good and positive letter recommendation. A lukewarm letter recommendation, even from a big wig, could sometimes be to your detriment. The third thing and the next thing I want to talk about is sub-I, also known as audition rotation. Be strategic on where you do your sub-Is, especially if you have geographic concerns. Like any other residencies, programs are regional and tend to interview people who are from the region as they're more likely to stay in that area for residency. Let's say you go to school in the West Coast and your family members are in the West Coast, but you wanted to move east for residency for a personal reason, for your significant others, for example, then doing a sub-I in that area could show that you have explored the area and are serious about moving. Next, sub-I could be a good time for you to get a big wig letter recommendation, especially if you don't have a home program. I actually know someone in the past who do auditions for the sole purpose of getting a letter from a certain faculty, so just to keep that in mind. I do want to caution that sub-I is a double-edged sword. It's a good opportunity for you to see the program, but it also is a way for the program to get to know you, both the good and the bad. If everything went well, then that's great. But if not, as stated previously, urology is a small world, and trust me, faculty and residents do talk to each other about applicants. The fourth thing I want to talk about is to be ready. Along the line with the audition being a double-edged sword, the best way for you to showcase yourself is to be ready. Now, I highly recommend the Pocket Guide to Urology by Dr. Weider. It's a concise book with bullet point summary of various urology topics. You'll find every single urology resident with one. Besides this book, use every opportunity to soak up as much information as you can during conferences and journal clubs. Another quick story time, during my research rotation, one of the neurourology drugs at that time called abiraterone sponsored a journal club. I went home and looked it up, and lo and behold, during one of my sub-I, the chairman asked a question about it and was very impressed that I knew the answer to it. The fifth thing I want to talk about is fit. When you're doing your sub-I, just pay close attention to how the resident interact with the faculty and see if that's an environment that you can thrive in. This is also where your interview comes to play. Just keep in mind, when you're offering an interview, you truly have a very good shot of getting a spot. Imagine for a program to offer you to their hospital and turn down 100 other for interview spots, they really want to get to know you. Now, this is a time to showcase yourself, but make sure you practice and be strategic about how you answer your questions. You'll be surprised some of the answer we got in the past. I'll probably make another video for some tips and tricks, especially for interviews. Your interview is a time for a program to see how well you fit into their team and vice versa. Just keep in mind, 5 to 6 years is a long time. You want to make sure you can be happy there, and that's what the program are looking for too. Well, that's all I have for now. If you find this topic interesting, please leave a comment below, hit the like button, and subscribe. Best of luck on your journey, and please feel free to DM me or leave a comment below if you have any specific questions. I do have other couple non-urology related videos. Feel free to check those out, and I'll see you guys next time.